when we think about astrocyte subsets, right, and their potential roles in neurologic diseases, a corollary to identifying those subsets and pathways that regulate them is trying to identify therapeutic interventions that could be used in order to modulate these different subsets. And indeed, for example, we recently identified a pathway which is controlled by EphB signaling, the EphB receptor in astrocytes. And that's very important because we were able to establish that this receptor, right, mediates its pathologic activities or its disease-promoting activities in MS and potentially other neurologic diseases via the activation of its tyrosine kinase domain. From a therapeutic perspective, that's very exciting because we can develop specific inhibitors of this tyrosine kinase activity as a way of having new therapeutics. Indeed, we have developed what we think are very promising CNS permeable kinase inhibitors that interfere with this pathologic activity of EphB signaling, and indeed this inhibitor is able to ameliorate disease in both acute and progressive models of EIE, and hence we believe this would offer a candidate therapy for the treatment of progressive MS. So we have developed, as I mentioned, a new inhibitor for EphB3, which we believe is a good lead compound as a potential therapeutic for progressive MS and other neurologic diseases. Our current plans are actually to optimize this specific small molecule through well-directed, well-designed medicinal chemistry studies, with the idea of increasing optimizing it so it can be tested in a phase 1 clinical trial.